In this video, I'm going to give a Notion tour to the notes that I used for years 3 and 4 medicine. So this is where we have our clinical learning. So it's going to be learning about a series of conditions and then do a short demonstration about how I'd review one of these topics. And so essentially with year three, we have a series, I've organized this by a series of systems and picked a miscellaneous emoji related to that system. And then let's say we want to study something related to the gastrointestinal tract, and then I'll have particular conditions. Now, the ones, twos, and threes are things provided by the university, which just tells you which topics are important to know lots about and which topics you don't need to know much about. So the common or dangerous conditions are more likely to be one. So for example, angiodysplasia, I might, well, actually, that's quite long. I'm hoping some of these three ones have shorter notes. But the number one topics are generally quite longer in terms of my notes. Uh, and the number three topics are generally a little bit shorter. Hopefully, this is my third year Notion. You'll be able to see the difference in length between third year and fourth year when I've been using this for a bit more. Because when I'm just looking at these now, like the length of like text here is way too long. You might notice some highlights. What that means is when I'm reviewing a topic, I will basically, before this opens, I'll say, okay, what do I know about GORD? Well, like GORD stands for gastroesophageal reflux disease. It's a condition where acid from the stomach refluxes back into the esophagus. And then I'll try and explain everything I know about GORD. And I have the same subheadings and everything. I'll have what is it? How common is it basically? What are the risk factors? Well, what's the cause? A brief a brief explanation about how it occurs, symptoms, how do you diagnose it, and how do you treat it. And this is a bit more detailed than I would ideally like because it's a topic one condition. But then anything I don't get, I will sort of highlight. And so let's say in this case, I've missed the fact that, GORD is quite prevalent in babies. And so what I'll do then is I will go on Anki and I will just add a new card and basically we'll just switch and just take this and copy and paste it directly into the back of my card. And I'll say, GORD prevalence in babies. And then that's my card done. And so all the highlights, if I deem them important, I will then put on Anki. And then that's how I will make my cards. Now so this is an example just of how things are organized. This is the date which I last reviewed these topics. And so I reviewed them all in preparation for my final year exams. But I'll hopefully you'll notice the difference. So this is quite long. Um, but hopefully you'll notice the difference between this and some of the fourth year topics that I do. Because ideally, it's a bit shorter. There's probably too much information there. I was just, extra keen. So if I go into, so this is my fourth year topics, so Psych, Peds, GP, and ONG. So ONG is obstetrics and gynecology. Now, so for something like a R1 in this specialty, my notes are a lot shorter. Now, this I think is a good amount of information. It's really succinct, and I'm basically saying what is an endometrial polyp? What are the risk factors? What are the symptoms? How do you investigate and how do you treat it? And so when I'm reviewing something like this, it's pretty short. Like I can review this in a minute. I can say an endometrial polyp is a outgrowth of the endometrium. Risk factors, I think it's associated with estrogen exposure, tamoxifen, etc. Symptoms, painless bleeding, probably asymptomatic and diagnosed incidentally on ultrasound most often. So the diagnosis would be via ultrasound. Treatment, you can leave them if they're not bothering, or you can excise them if they're causing persistent bleeding or suspicious of malignancy. You might want to biopsy or excise them. And then I'll just look through and I'll say, all right, I got tamoxifen, I got estrogen, I missed obesity. Um, this is interesting, so I wouldn't have thought that's the case. So then maybe I will say, as an Anki card, role of contraceptives in um, endometrial polyps, and then this is the back of my card, and that's done. So it's all pretty quick. Asymptomatic or bleeding. So then ultrasound is the investigational choice, and then the biopsy here, and then you sometimes can leave them, sometimes we'll remove them. So that's a good example. And even that's for an R1 condition. That's the length I like to keep it to. And here's another example for an R3 condition. Now, there's certain conditions where you need to know a bit more about. So I'm sure like my endometriosis, it's a bit longer, but this is actually quite a good length for even quite a important condition. It's not too long compared to some of my third year ones. And so this is a lot more easy to learn. This is relevant because there's quite a lot of conditions in here. So if you have to learn lots and lots of information for all of that, it's just going to be an overload. But the basic premise is, maybe one day I'll get, one or two of these batches of questions done. So I might get five to 10 conditions done. Every condition, I'll just say, all right, what do I know about adenomyosis over the same categories? What is it? What are the risk factors? What are the symptoms? How do you diagnose it? How do you treat it? Five things. That might take me 1 to 2 minutes. Then I'll look through and say, all right, what did I forget about that? Let's say I missed, the thickening of the transition zone of the Venetian biome pattern, and then that can just be my Anki card. And I'll just copy and paste that, and I'll say, adenomyosis, ultrasound description, and then I just copy and paste that in, and then everything from there goes to Anki. Once I've worked through that, I'll put a date, and I'll probably review that like 2 to 3 times per year. So once, every half semester. And then probably like in the month before the exams, and then the Anki cards will be the important things for more common things that I want to really know. So hopefully that's helpful. I'll keep it short and sweet. Please let me know if there's any questions that you have. Um, I can't vouch for some of the integrity of this material, so don't copy it into your own notes just because I always make mistakes sometimes. And these are some older things, so guidelines may have changed by the time you see this video. But thanks for the person in the comments who suggested this idea. Always up for new video suggestions if anyone else has one. See you next time.